Good morning, everybody, and welcome back to your Lunch Break Live. Today is Wednesday, it's hump day, and unfortunately, it is a day in the week where we have had a lot of increases in our case numbers of coronavirus across Alabama. Now, we've seen this rise across the country. We're also seeing it here in Alabama, unfortunately, and I thought today would be a good day for us to go over these case numbers. We can look at your specific county if you have a question about that county. And I brought on our own Lita Gore from AL.com, who has been keeping up with all of these numbers since March, which feels like 45 years ago, but also yesterday in a weird way. I think we've been living in March all year. But Lita is here. She has been keeping an eye on it and can kind of tell you, the trajectory of each county at this point and what it looks like compared to what it did a little while ago. So, Lita, thanks for coming on. I know that, I know you're glad to do this, but I know we hate doing it. We hate having to say these cases are going up. We've got more cases.
Yeah, I was really hoping about 2 months ago that this report, as far as having to look at it every day, was really winding down. And it did wind down there for a little while. Unfortunately, like the rest of the country, it's now shooting up. And there are some differences from the beginning when we saw those cases increase. And today, I just pulled the numbers just right before we started talking, and we were up 2,638 cases, which is extremely high. And interestingly enough, the ADPH, the Alabama Department of Public Health, didn't always break out confirmed and probable cases. They used to just report cases. And then they started breaking them out. Well, confirmed are obviously your long range sort of tests, those tests that we've all heard about. The probable test or the probable results are one of two things. They're either quick test, which we know has a higher error rate, or they are people who were exposed, showing symptoms, but have not been tested, which is a smaller part of that. In the beginning, when we would see large spikes, we would see a large spike in probables, not confirmed. Today, in the last couple of weeks, it's flipped. We're seeing a high number of confirmed and a lower number of probables. So like today, we saw 889 probables to 1,749 confirmed. I think that's more people are realizing that they want that long range, they want it confirmed. They want a full-on test and probably greater access to testing, the longer deal test. But we have definitely in the last 2 weeks seen a big increase in numbers.
I'm going to get to the counties in just a second, but first, let me just quickly give an overview. I know Lita said that overnight we added in Alabama 2,638 cases overnight. We now are at a total in Alabama of 223,486 cases. Of those, we've got 3,347 deaths. And hospitalized are 22,716 Alabamians. So I'll again say hospitalized with COVID are 22,716 people in Alabama. Now,
it's a cumulative number. Yeah, the cumulative number is 22,000 for hospitalizations. I didn't look at today's hospitalizations. It's been around 1,200.
So, I'm going to get to these questions in a second, but I have a quick question for you, Lita, and a quick note that I want to say. The note I want to say is we've got some people concerned about this is flu season. We are probably going to have more people coming down with the flu, but I think that we need to go ahead and note that the test for coronavirus is a completely different test than the test for the flu.
Yes.
So we'll go ahead and knock that. That one's easy. We'll go ahead and knock that out. Now, I have a question that is prompted by a comment from a Mr. Weaver, and he says there's so many rapid tests positive. Now, Lita, we have seen this. We know that those rapid tests do have a higher false positive rate than their longer term test counterparts. But Lita, let me ask you, if you take a rapid test and you're positive, you go back, you follow the protocol of getting 2 more within that certain hour period, and you discover you had a false positive test, does that number come off of the dashboard and be
it is supposed to. It is supposed to. Okay. I'm going to tell you, when we started this, it's kind of funny. We were looking at each person who tested positive, like, what do we know about the first case? We had no concept of 280. We didn't know how many that was going to be. Can I tell you that they all come off? No, because that's a huge number to be dealing with each person. But there is supposed to be, if you are probable and then you switch to confirm, you are supposed to come off one and go to the other. As far as the count goes, and people keep saying this, and I know you and I've talked about this a lot, is that if I test 16 times, I'm still only one case. I don't count as 16 cases. And to go back just a little bit, and I think people will be interested in this, one of the things I have been watching is the flu in Alabama. And we are actually doing much better on flu. Last year at this time, we had widespread flu activity in 3 health zones, which just divide the state up into about 6 parts. That's a health zone. Now we only have minimal activity in 2, and the rest is negligible. So there is some good health news out there, which is while our coronavirus numbers going up, our flu numbers are lower than where they were this time last year. So there's your happy news for the day.
Yeah. I know. I'm glad you said that. We just got a question from Melissa asking about the numbers for the flu. So, Melissa, those flu numbers are actually a lot lower than they normally are. And we know that this can be attributed, according to medical professionals, of a lot of the precautions we're taking for coronavirus is also helping to stop the spread of that flu. So, but we will note again, those tests for coronavirus are not tests for the flu. So there is no way that those numbers get mashed up. I want to just keep repeating that on this video. And somebody says flu lower because of social distancing. Paulette, you're probably right. Probably is. The mask, the social distancing, the staying home.
Yeah, all the things that help prevent one help prevent the other. I just think it's very interesting that sort of the subtext of this whole thing is we didn't want the flu colliding with coronavirus. Well, luckily, right now in Alabama, which is typically really heavy flu season right now, we're holding it off. So there's some good news.
I'm looking through again some of our comments now. We've got one from Jacqueline, and she says, if you test multiple times at different locations, that only counts. Does that count as multiple tests?
No, it's one. It follows the person, not the test.
So if you are one person, your number is going to be on there once.
You're it. You are the case. You are, Now, I always caution, I don't like to ever say, absolutely, that never occurs, because as soon as I do, somebody's going to say, oh, wait, because humans are involved with doing some of these things. But I would say the vast, overwhelming 99.9%, one test, 15 tests on the same person is one case.
Now another quick, we got a comment from Wanda saying she's been tested several times. She's getting negative results, but she's still sick. They say it's pneumonia. Wanda, we hope you get better and hope you find out what you're sick with and that you feel better. Lita, we've got so many questions coming in. I appreciate all of them, but let's look at the map first, and then we'll pivot back to some of these questions. So I'm going to pull up here in a minute a map that shows you, according to the deep color of blue or the lighter color of blue, the shade of blue, we'll say, that is where more cases have been concentrated in the last 10 months, 9 months since we've been battling this pandemic here in Alabama. But Lita, we should note that, it's kind of hard to show this data in a map form right now. So I'm going to show that, but we're going to rely on you to kind of give us those overnight numbers and the numbers that we're looking at per county. So y'all can start throwing me out your counties. I know that some person said right when we started, it was Becky, that they wanted Baldwin County. So let's start out with Baldwin County.
Baldwin County, I've got that number right in front of me. Let me say this to you. Y'all were at 77 overnight. I haven't done the math on all of them. I got to Jefferson before we came on, but because the numbers come out generally at 10 every day, and it takes a while to get them all put in. Let me say this. If you are in the state of Alabama, you need to assume the numbers are going up in your county. Now, some counties more than others, but whereas in certain times we would see a county spike that could be attributed to a specific issue, an issue at a nursing home, an issue at a veteran's home. We are now seeing, and the ADPH confirmed this week, widespread community transmission. Even in places where the numbers are lower, they're steady. And I think that's where people get concerned. It's where I get concerned. For example, I'm going to look at Calhoun County. Calhoun County has been more active than some of the counties, but like they added 62 overnight. Coffee County added 28. I think it was Dale. Cullman added 108. DeKalb added 92. It's double-digit increases. I won't say across the board, but it is. I would, back of the envelope math here, I would say it's probably at least half that we're seeing double-digit increases. Now, what is interesting is after we saw a spike in hospitalizations, that number has started to come down. But I think that sort of goes along with what we're hearing from a national standpoint and from a medical standpoint, is that our hospitals and our healthcare providers have gotten better at treating coronavirus. So that if you are hospitalized, it may not be the long slog that it was, say in June. And we're not hearing the same thing from our hospitals. It doesn't mean they're not dealing with it. It may be just they had time to get better equipped. Interestingly enough, I'm going to throw a phrase out there, and I want y'all to say if you've heard it at all. Has anyone ever heard flattening the curve in the last 4 months? My guess is no, because I haven't heard it since March. So, I think that they gave up on flattening the curve.
I'm going to find the best map to pull up here. Some of them, again, it can be kind of hard to read. So I'm trying to pick the best one to pull up here. But can you tell us right now, Lita, one of the counties we're getting asked about is Calhoun County. Can you give us the numbers for Calhoun County?
Calhoun County right now is, they're at 5,762. They added 62 overnight. And one of the things, when the health department started tracking in August, we had 9,000 kids that had tested positive. Thankfully, no deaths from age 5 to 17. We are seeing increasing numbers of cases and quarantines in schools. I don't know if that's exactly Calhoun, but we are seeing that across the state. But another bit of good news is we still had no deaths ages 5 to 17.
Very good news there. Now I'm going to leave that map alone for a second and look at some of these numbers. Now we've got questions on Crenshaw County and Lee County. I'll do them in twos for you, Lita.
Yes, thank you. Crenshaw, let me scroll. Crenshaw, hey, good job. You added 3 overnight. You're at 683. Sometimes I'm seeing in some of these counties, you can almost see the exact number of increase every day, and it makes me wonder about testing capacity in that particular county. But Crenshaw has kind of held their own. And Lee, let me see. I think I did get to Lee. Yes, I did. Lee added 53 for, Lee was a huge concern area. All that down there early on really spiked up a lot. They had some issues with some nursing homes. They had some issues in general. They were one of the first to peak and then come back down. 53 is not horrible. I wish it was 3. Of course, I wish the day that I can write, we added 3 cases in the whole state. Y'all may hear me yelling from North Alabama. But like I said, if you are in this state, you need to be operating with as much precaution as you can, because just assume the numbers are going up where you live, because they are.
We've got questions on Covington and Houston counties, some South Alabama counties here.
Yeah, Houston, you were up 56. So given the size of that county, we really don't want to see that. Covington, you were up 10. So 10 reasonable. The issue is, of course, if you're up by 10 and you're exposed to each of those people, exposed 10 other people, you're up by 100 before too long. And that's kind of what we're seeing. And just last week, health department this week came out and said, we're seeing now Halloween, sporting events. I'm not a medical expert, didn't take biology other than high school. But I really think we're seeing a lot of the impact of activities coming indoors. Whereas when we were outdoors, playing football, it didn't seem to be striking as much. Now that we've moved more indoors, it seems to be going up more. They have said, yes, that is absolutely what's contributing to this. Well, then now you go into Thanksgiving, you go into shopping, you go into Christmas. So it's just imperative that people, I'm not a believer in shutting down your life, but I think you've just got to be safe.
Questions here for Etowah County and also for Shelby County.
Etowah County, let's see. Etowah added, Etowah, sorry, don't mean to make a face, but you added 122 overnight, which brings you up to 5,562. Let me look at Shelby. Shelby has
That's
really
a lot there for Etowah. That's a lot
it
for
is
that.
a lot for Etowah. And Shelby, which of course people forget that Shelby County has a large population, but Shelby County added 157 overnight. And your Tuscaloosas, your Shelbys, Madison, my home county, had really done well. We were up over 170 overnight. And just like last time, your Jefferson has really, it's in the 350 range. But of course, when you have bigger centers of population, you also have more access to health care. So it's not that I'm not concerned about Shelby County, but you can throw a rock and hit a hospital in a lot of places. Whereas if you're in more rural parts of Alabama, 10 cases in a smaller county might be much harder to deal with than 50 cases in a bigger county.
Mm-hmm. And we'll note that again, we have had during this pandemic 22,716 Alabamians hospitalized. Again, that's not currently, that's throughout the pandemic, but that's quite a few. We've also had 3,347 deaths. And again, cumulative cases were at 223,486. 2,638 were added overnight of those cases. So we've got a question on, let's see, Marshall County, and then we've got Pike County.
Okay, Marshall, again, I make a face, I'm sorry. Marshall was up 132, and Marshall has really had issues. It really has. I think, there's lots of reasons for that, but I think they were one of those counties that you wouldn't expect. So if I was in Marshall County, I'd really play it safe. Pike County, good job. You are on the super low end. You added 4 cases. And Pike is interesting because they've only had 1,000 cases since we started. So it's really, I don't know what you're doing there in Pike County, but, good job to kind of keep that under control. And there are places in Alabama, not just rural places, that have not seen a big increase.
Pike, yeah, good on you, Pike. Maybe you can help us out here. What about Jefferson County, Lita? We know Jefferson County is the most populous county in the state. How are we looking there?
Well, Jefferson's kind of, I don't want to say a hot mess, but kind of. Jefferson has posted, I think the other day it was 458, which is just frightening. Jefferson was up 361. Interestingly enough, I've been trying to keep up with school. We have lots of schools that have switched back to virtual, but a lot of it's like for 2 days, because thankfully, one of the good things about the Thanksgiving holidays, a lot of schools had already decided to close next week, or we're doing virtual part of the week or something like that. I've not seen as much out of Jefferson County. So I don't, as far as school closures or switching to virtual, I shouldn't say closures. But so it must be, it may not be necessarily school related as it is, an older population. I have not heard of a nursing home or, they've limited visitation and done so many things to kind of protect our older people that helped a lot. So I don't know if I've not heard of a central cause in Jefferson County.
Let's talk about Cullman County. Cullman County for a while there had some issues happening in Cullman County. How are they looking now?
Cullman County has some issues again. Cullman was up 108. And when you look at geography of Alabama, I can almost trace you, when you get issues in Madison, you get issues in Morgan, you get issues in Cullman, there is a huge corridor of people that travel all those 3 ways. Sometimes as far as Jefferson County, there are people that live in Cullman, certainly, that work in Jefferson County, even in Morgan. So I saw a great comedian this week that said, if you travel for Thanksgiving a mile before your county line or state line, open the windows and let the coronavirus out. And it's kind of, we picture that. We look at this county because obviously that's where we live. But you have to remember that, I may live in Madison County, but I am literally a mile from the Limestone line, so I may shop in Limestone County. And so while your case counts where you live, your contacts don't. And that's where I think you'll start to see these sort of geographic areas where it'll start in one and then just kind of exponentially go to the surrounding areas, because people, especially with sporting events. You drive, you go to different places, and that's what happens.
I was looking at somebody, I believe it was Danielle's, and she lives in Cullman. And when she goes to Walmart or grocery shopping, she says that most people are wearing their masks and distancing, and that workers are also wearing their masks. So we're glad to hear that, Danielle. Hopefully we can get that area under control. And I live in Jefferson, and obviously Jefferson is not under control either.
Yes.
A good question that I think is interesting from Deborah. Deborah says, what is the highest concentration of cases in the state?
Let me look, because I don't know that off the top of my head, but that is a great question. But luckily, the health department's website, bless it, is not, I don't want to say it's not user friendly, but it can be quite the, you have to look, let's just say it that way. You have to kind of dig. The highest concentration is probably going to be Jefferson. Mm-hmm. But then, Jefferson's kind of interesting because they do a lot of zip code. Mm-hmm. They break some things down by zip code. Yeah, I'm thinking right now it's Jefferson. But again, a lot of that's based on total cases and not, each particular county. Hold on just a second. I'm sorry, I'm shifting around tabs here.
I'm also trying to shift around and to get.
Yeah, and that's great. I need to get you that answer, and I will find that information and put it up there. So that we can know. It is weird because you get into density, you get into, the other things about it. But I can get you that information. I'll put it in the comments.
Thank you, Lita. Now I'm pulling, this is a different graph up on the website that we were just talking about, the Alabama Department of Public Health dashboard. And I'm going to do this one. And this, I know you probably can't tell, but I've selected Covington County. I had several people asking. And this is an interesting way to see that. Covington County, you've got cumulative 2,057 cases. And you can see what was added in the last 14 days and et cetera. So we can look at those numbers too. You have a county that you need to look at, and you need to know that information. Let me know. We have a couple of questions from Mobile County as well.
Okay, sure, go ahead. No. Let me say this just real quick. Is the other thing that makes that a difficult question to answer is kind of like if a sheriff comes out and says they are the best at catching DUI, drunk drivers. Does that mean they have, would they have the lowest amount of DUIs in the state? Does that mean they're good at catching DUIs or they're bad at catching DUIs? Mm-hmm. So what you have to look at in concentration is, does that mean there is an adequate number of tests, or is it just not enough people are getting tested? So it's kind of a hard question to answer. We can look at what we know confirmed per county, but please know, I saw a statistic this week that said for every 1 confirmed, there are 10 non-confirmed. So
this is Mobile County. I believe it was Carolina asked about Mobile County. We've got 18,834 cases. But what did Mobile County add overnight, Lita?
Let me look at Mobile real quick.
We've got somebody saying in our comments that the 7-day average cases per 100,000, the highest is in Marshall County. So
that is probably pretty accurate. 7 days, yeah. Or maybe I would think Jefferson would be higher because their numbers have been higher, but concentration, Marshall's probably, I'm looking at some weird numbers for Mobile. Mobile's showing a big increase in probables over 150, but they're showing some weird numbers in confirm, which would be a negative number, which usually means someone tested in a county, but then they showed up in one county. So I need to look at Mobile. I would say they added 150 is what they added. So, which is not, horrific, but we have seen, it was interesting because Baldwin and Mobile, of course, are right there together. And we saw over time that Baldwin wasn't adding as many as Mobile. Now it looks like Baldwin's adding more than Mobile. So it's kind of like I said again, that geographic swapping back and forth. But Mobile has been in the 100s for about 3 days now, 100 case increase every day.
Let me just get those quick numbers on Chambers County and Escambia County.
Okay, Chambers is 25. Their total is 1,620. And Escambia, was that Escambia? Mm-hmm. Escambia was at 25. So very similar numbers.
We got a question from Jennifer asking about the 150 added in Mobile County. Were those probable or confirmed cases?
Those are, let me look at the statistics here. I have to go back and look because the health department does not break that out on this one spreadsheet. I think most of those are going to be probable. Probable. So they've got something weird going on with the data in Mobile. I need to dig down into that because if you've got a negative number in confirmed and a high increase in probable, there's something weird going on there. But we'll look into it.
What about
the numbers just came out before we started talking, so.
I know I didn't give you much time to prepare. What about Chilton County?
Chilton County. Let's see. Oh, good. Chilton was 11. And of course, there's some busier population area. Not huge, but certainly some population areas there that are decent size for Alabama. So they've only had 2,104 cases overall. So they're another one of those areas. And a lot of people in Chilton County, because of the proximity to Shelby County, the proximity to Jefferson County, and even the proximity to Montgomery, work in other areas. So that's really one of those big commuter counties. So that's interesting.
Now I'm trying to get these last counties, and I want to answer a couple of questions before we go here. And there's a question regarding first Alex City, and so I believe that's
Tallapoosa, isn't it?
I think it's Tallapoosa County.
Yeah, so, Tallapoosa County. Let me look at their they were only at 3 yesterday. Let me look at their.
And while you look at that, I'll answer Benita asking about Birmingham. Now, Benita, Birmingham is primarily in Jefferson County. There's a couple of outliers, but Jefferson County added over 300 overnight. Jefferson County, I'll get you that total number here while Lita talks about Tallapoosa.
Tallapoosa is another interesting area. Tallapoosa only added 28 overnight. And yesterday they added 3. We saw issues there, and I could be wrong, but that Tallapoosa was one of the counties that had some issues at nursing homes, and I apologize if I'm wrong, or veterans homes, because some of these things have run together over the months. But they're another interesting county because of the nature of recreation and things that go on in that county, that you really could see a big influx. Luckily, during the winter months, maybe you're not hanging out and not as many people going to ball games, which cuts down traffic a lot.
Now I'm pulling up the numbers here for Jefferson County. That is 28,781 cases total, 481 deaths total. I think that Benita had asked about Birmingham, which again primarily lies in Jefferson County. A couple outliers there, but that's the main one. Now I want to quickly, before we go, Lita, I want to answer a couple questions. And one is about schools. We had somebody saying, "Do you think schools are going to close down?" Well, I do not remember the gentleman who asked that question, but we're not in the business of predicting things, so we've got to wait to see on that one. But Lita, we do know that there have been several schools that have already switched to virtual learning because of rising coronavirus cases.
Yep, I got an alert on one that happened while we were on the phone. Sparkman High School, which is one of the largest high schools in the state. But what we're seeing is, while we are switching to virtual, we are not seeing shutdowns. The most I've seen, a lot of schools were already out next week, so we're seeing like these temporary. We're closing. I had one school that closed because they wanted to clean the schools. We're going to send them home for 2 days. What I'm not seeing is a huge return to we're shutting down for the month. Now we could see that, like Ivana said, we don't predict. I don't predict anything, but we're not seeing that. What is interesting along the shutdown lines is Governor Kay Ivey came out today and said no shutdowns. Now, she's not in charge of schools per se, but from a business standpoint, Kay Ivey is saying we will not go back to a huge lockdown, which we're seeing with a lot of Republican governors right now, sort of laying that groundwork. And the Business Council of Alabama came out yesterday with its own plan that says don't shut us down. This would be a horrible thing for so many business owners that were able to survive to lose that Christmas business. So like schools are kind of their own issue. But from a business standpoint, the governor's making it clear there won't be any widespread shutdowns.
So my advice to you would be check with your school on
Yes.
that. Some have transitioned, shifting to virtual learning for a little bit, a couple weeks or so. So get with your school, and hopefully you can get that information you need there. Quick shout outs. I believe Wanda here is battling coronavirus, and we are thinking of you, Wanda. Hope you get better soon. And we're keeping you in our thoughts. We've also got Denise and Paulette that said they had several friends who have passed away from coronavirus. So we our sympathies are with you, and all of our good vibes to you. Now, Lita, I know this is probably the last time you and I will get to do an update like this before Thanksgiving. So
Oh, sorry, Ivana. I hope though.
I know. I hope that. I love you, Lita, but I hope so as well. So everybody, thank you so much for tuning in. If you would like to have an update on like these videos, let us know. We can do one after Thanksgiving for sure. And, we can start looking at how those numbers are going to be affected. So everybody, thank you so much for watching. Lita, thank you so much for coming and breaking this down. And everybody, will see you.